I'm Dr. Pooja Lakshmin. I'm a perinatal psychiatrist. I specialize in women's mental health, and I live and work in Washington, D.C. And on Instagram, I'm at Women's Mental Health Doc. So I take care of women who are pregnant and postpartum and dealing with things like postpartum depression, postpartum anxiety. I often work with women who have struggled with perinatal loss, recurrent miscarriage, things like that as well. So I'm really excited to be here today to talk about this really important issue, especially given that it's October, which is Pregnancy and Perinatal Loss Awareness Month. So it's kind of perfect timing.
Absolutely. What you do is so invaluable and so important. So thank you for choosing to go into this field and giving your life to it. So what I wanted to start with is talking about exactly what is perinatal loss. What does that mean?
Yeah, so it's kind of a broad term that actually encompasses a bunch of different types of loss. So perinatal loss can mean miscarriage, during your first trimester, where we know in the first 12 weeks of pregnancy, the rates of miscarriage are as high as 1 in 4. And then it can also include things like having a stillborn or having late-term pregnancy loss. Also, kind of less common or less talked about things like termination for medical reasons. So it does encompass actually a whole range of different types of loss, but basically, and infant loss as well too. So it's a pretty wide range, but the commonalities are obviously the grief with that loss.
Yeah, and I think it's really important to stress that these are all valuable and meaningful losses to people, no matter what stage of pregnancy you're in. So it's not like somebody, at least in my opinion, should deal with it just because they didn't have the pregnancy quite as long as someone else.
Absolutely, right. And I think that's a place where our culture really doesn't do a good job of allowing women to let themselves feel that grief and have time for that grief. If it's a miscarriage that happens early on, it's just so common for me to see my patients just kind of be like, oh, I was only 4 weeks, I was only 5 weeks, you kind of dismiss it, and you just want to kind of move on to start trying again. But it's so important actually in order to prevent having mental health issues going forward, to give yourself time and space to actually grieve the loss and let some of those feelings come out, even though it is difficult to think about that and to feel it.
So before we talk about how to grieve the loss, which I think is really important, how do people, what are the range of ways that people respond to loss?
Yeah, so I would say that in my practice, I work with a lot of women that have anxiety or have depression, obviously. So I think in my practice, I definitely see a bias towards actually just wanting to ignore it and just kind of wanting to put on a brave face and be like, it's fine, it's okay, miscarriage is common, I'm okay, I'm fine. I went to work the next day. So there's definitely, I see that a lot. I see kind of wanting to dismiss the loss, not wanting to let yourself really go into the feelings. And I think psychologically, one of the reasons that happens is because it can, oftentimes we have a fear that if we let ourselves feel the sadness, that it's going to last forever, that you're kind of going to get stuck in that feeling of, in that sort of down space. When in reality, the truth is that when you let yourself feel it, it will pass, that it won't last forever. But we have this fear that if we even just let in a tiny bit of the grief, that we're kind of going to get stuck there. So I would say in my practice, I see a lot. That's the more common reaction that I see. The other thing that I see a lot of, and that we know is common, is that once you've had one loss, whether that's an early miscarriage, whether that's something like having a stillborn, even it doesn't really matter when the loss was in terms of the pregnancy, but your subsequent pregnancies are then impacted, and your ability to connect with a subsequent pregnancy is impacted. So something I see a lot of in my practice is women who get pregnant after having a loss, and just really, really being scared to emotionally invest in the pregnancy, not feeling like it's real, being really worried, what if it happens again? And just frankly being terrified about how things are going to go. And we know that women that have a history of miscarriage, especially women with a history of recurrent miscarriage, have higher rates of depression, anxiety during pregnancy, higher rates of postpartum depression, higher rates of postpartum PTSD. So it's important to know that miscarriage can impact, future pregnancies from an emotional health standpoint.
And do you find that that extends into when they're raising the newborn infant, like that anxiety or that stress over the health of that baby? Is that also affected?
Yeah, I think it depends. It really, I think, depends on how much processing they've given themselves time for the miscarriage. So if it's somebody that had a particularly traumatic miscarriage or particularly traumatic loss that they never went to therapy for, or they never really talked to close friends, they never really acknowledged it, then it does end up coming out in different ways and showing up as anxiety or postpartum anxiety.
Mhm.
And even in raising their children. Yeah, absolutely. But I would say that women who are able to sort of give themselves the space and the time to heal from loss when it happens, then end up doing much better emotionally when they go on to have successful pregnancies and raise children.
That's really good. So is it enough to just talk to friends? Like, do you think that helps complete the cycle, so to speak, of dealing with that loss or kind of leaning into it?
Yeah, so I think it really depends on what your mental health history is. If you're somebody who has not had, prior traumas in your life, you've never suffered from depression or anxiety, the loss was not something that had other extraneous complicated factors, then very likely having supportive friends that are non-judgmental, that can empathize with you, having that safe space to be able to speak openly, to cry, that can often be enough. Everybody that goes through a miscarriage, not everybody that goes through a miscarriage is going to end up having depression or anxiety. The rates are somewhere between 10 to 50%, right? So most women, the majority of women, are going to do okay. But if you're somebody who, has had recurrent miscarriages, if you're somebody who has had depression at other times in your life, if you're somebody who has family trauma, things like that, other pre-existing risk factors, then you might need more. You might actually need to see a professional, to see a therapist, or to see a psychiatrist.
Yeah, I mean, if you think about it, 1 in 4 women go through a miscarriage, and then even if 10% of them have some depression, anxiety, that's a lot of people who
Mm-hmm.
really probably need some form of therapy outside of just confidants and colleagues and
Mm-hmm.
friends and things like
Mm-hmm.
that.
Mm-hmm.
How can they go about, when they're talking to their friends, or how can like they feel comfortable, or what are some techniques you offer to your patients that might help them share that loss or kind of grieve through that loss?
Yeah, so I think it's really important to pick the right person. That's the first piece, to go to somebody who you have a history of disclosing difficult topics to, or somebody that you can trust, and somebody who previously has reacted with acceptance and support. You don't want to go to somebody, if you have a friend in your circle who's overly critical, that's not the person to go to. So kind of keeping that in mind. And oftentimes it's actually easier with this type of stuff to go to friends versus going to family, I think. Because, with family, especially with like parents, grandparents, etc., they are so much more invested in how their identity, their projected identity that's going to change if there's going to be a grandchild in the picture. So I think it often is better, if possible, to go to friends who don't have that kind of vested interest. They're just there for you. I think that also, if you can, asking for what you need, saying that I just want to be able to share a little bit about how I'm struggling right now. I just want a space to be able to vent. I don't expect you to be able to fix this, but I'm struggling and I just want to be able to talk about it. And as a friend, what's really important is just opening up a space to listen. Um, I think that loss, perinatal loss, is one of those topics that's difficult because when we're trying to support others, because it touches on our own grief, right? And that can be kind of scary. People don't know what to say. They also don't really know how to hold it. So there's this tendency to want to try and fix it or make your friend feel better. And that ends up feeling worse for the woman who's just had the miscarriage. So she doesn't want to hear, don't worry, I'm sure you're going to get pregnant again soon, or, you're still really young. You're not going to have any problems, right? Like, she doesn't want to feel dismissed. And I think as a friend, it's not your intention to do that dismissing. It's just you're trying to make them feel better because it feels uncomfortable, right? To just like sit with that feeling of grief. But what you want to do is just really hold space. You can even ask questions too. It's helpful to use the baby's name if they had a name picked out. It's helpful to just kind of ask open-ended questions like, what's the hardest part of this for you? Like, tell me more about what things feel like right now. Depending on when the loss happened and how far along they were in the pregnancy, you can also offer to take away some of the baby clothes or the stuff that's in the house, to get rid, or to hold on to it and keep it in your house if that's something that's possible. So those are some kind of small, tangible ways that you can do things to help ease some of that pain.
Yeah, and then if you're in a situation where you're going to your friend and they say something like that, what do you recommend that woman maybe say to? Because I don't think, as you said, the intention's not there to be rude or be trigger the person, but if they feel triggered but they still want to continue building that relationship of trust and talking to them about this problem because they're a good friend and they feel comfortable with them, what can they say to kind of alert that person and not necessarily be like, oh, don't talk to me about this, but just maybe that's kind of triggering to me?
Yeah, I think delivering feedback can be really helpful. It's hard to do in the moment, especially if you're in the midst of that grief process. I think it's more realistic after the fact. After you have the conversation, you could send a text message or an email and, kind of couch it in like, I value our friendship so much, and I count on you during this time as a big part of my emotional support. Something that came up in our last conversation bothered me a little bit, and I know that you didn't mean it intentionally, but here's what I noticed, and in the future when we're talking, can you do XYZ? And I think that if it's somebody who is a real friend, they'll appreciate that, because I don't think anybody's doing this intentionally, right? This is all unconscious. And so I think people need a lot of help to figure out how to be a good friend during periods of loss. And so in my experience, like, delivering feedback like that actually is a positive. It can strengthen the friendship, I think.
That's great. That's really great. Are there things that you find specifically in South Asian patients? I mean, I know that family can be, as you mentioned, very involved in the identity, in the whole idea, the postpartum care of the baby, and may have planned for things like that already. So how do you, are there things specifically about dealing with South Asian families that you find might be helpful?
Yeah, I think in South Asian families, if you're coming from a family where there are a lot of expectations like this, and where boundaries are not, where boundaries are frowned upon, I think it's really important to have friends that you can really lean on that are outside of your immediate family. And I think that it is helpful if there's some allies in the family, like whether that's your partner or, a sister or something like that, where you can say, hey, look, I need a little bit of help dealing with mom and dad, or I need a little bit of help dealing with my in-laws. Can you be a go-between? Can you set some expectations? Can you tell them, hey, I just need some space right now, or, whatever it is, or I need some help. Can you guys help take care of like other children in the house? Like, whatever would be most helpful. Is there a way that you can find an ally who's kind of a gatekeeper, especially if if you're dealing with sort of criticism or blame or things like that. I think in South Asian culture, it's really common for there to want to try and find an answer and to fix blame somewhere. And especially if you come from a religious family, there could be a whole set of other kind of explanations that are coming up that are more spiritual in nature, which of course are in their own way incredibly burdensome as well. So I think trying to find space for yourself and find space for your grief and understand that you deserve to have those feelings. It's okay to have those feelings, and try and finding allies in that is important. I don't know if that answers your question. I mean, I think it's tough.
Yeah,
It's tough
it
in
is tough.
Asian culture.
It is tough, but yeah, I mean, I think that's helpful. I think having someone go in between is really helpful, because it's hard for you to tell your mom and dad to, like, hey, I need a little space. Like, you need to stop asking me how I am, because it just ends up being this long conversation or whatever it is. But, you know, so when a woman finds herself in the situation where she feels like she might need some further assistance, how should she, what's a trigger that maybe she should definitely start seeking professional help? And then how should she go about finding it in her local area?
Yeah. So it's completely normal to have feelings of sadness, to have crying spells, to feel down. It's not that's normal. What we worry about, or when we start to worry, is if those feelings of low mood, or if the grief is starting to impact your functioning. So, you know, are you 2 weeks out from the loss and you're not able to pull yourself out of bed, so you're having to call out sick for work? Are you not able to pay attention or take care of your other children at home because you're so down and depressed? Again, taking a little bit of time makes sense, but is this something that's becoming a pattern that you're having trouble functioning? The other thing is, if you're noticing that there's intense feelings of hopelessness or meaninglessness, or even sometimes thoughts of death, or like life isn't worth living, those types of feelings can be an indication that this is complicated grief, or this is clinical depression, as opposed to kind of the regular grief process. So there's a couple different ways to get help. Usually the easiest and the quickest is going to be to reach out to your OB/GYN and tell them that you're struggling. If an antidepressant is indicated, they should be able to prescribe it. Many OB offices also have relationships with psychotherapists and psychologists and psychiatrists in the community, so they should be able to provide some referrals for you as well. Another great resource is called Postpartum Support International. They are a nationwide, well, actually they're an international organization, but they have chapters in every state and referral coordinators in every state. The website is www.postpartum.net, and you can search your state to find the email addresses of the coordinators in each state, and you can ask them for a list of referrals. They also have an online searchable directory. So most mental health professionals who work in pregnancy and postpartum take care of women dealing with loss too. So anybody that works in that space is going to be a good person to go to. Postpartum Support International also has an online perinatal loss support group. I don't think it's free, but I think it's pretty affordable. And if you go to that same website and just look up online support groups, you'll be able to find it. There's another organization, it's called Resolve. Resolve.org. So they are dedicated to recurrent miscarriage and infertility support. And they have a whole slew of resources on their website for support groups and also for providers as well. So, you know, and if you're somebody who's trying to support a friend, another great way to support a friend is to say, hey, let me find a list of some therapists in the area, or let me be the one to reach out to the postpartum support coordinator for you and get you some names. Like, that's another really nice way that you could potentially help a friend, because it can be, of course, absolutely daunting to have to make all these phone calls and try and wade through all this information. It's the last thing that you want to have to deal with during a time like this.
Yeah, absolutely. That's such an amazing support, like the coordinator, everything, the groups. I mean,
There's
that's
so
really
much.
fantastic.
There really is actually so much out there in this field. It's just a lot of people don't know about it.
Yeah.
But there really is a lot of support out there. Yeah.
And what about those? I've seen some of these like online virtual counselor sign up here kind of websites. Are those good for people to turn to?
Yeah, so that's a little bit of a controversial topic. There's definitely those companies, like Talkspace and things like that. One issue with some of them is that it's not actually face to face, it's texting.
Okay.
Which is not as helpful, right? Because such a big piece of therapy is to have like that dedicated time for yourself.
Yeah.
And that's
Yeah.
what's different about just like texting a friend, right? So I think that that's a little bit different. I haven't seen any patients who've used any of those services yet. I think especially when we're talking about pregnancy and postpartum and perinatal loss, it's just so important to find somebody who specializes in that field because the issues are so unique. And we know from all therapy, like all the research shows that the most important thing or the most important predictor of whether therapy is successful is your relationship with that therapist and whether you feel like they are non-judgmental and accepting and whether you can trust them. So doing that over, text message in a chat room just feels like it's not the best option.
And then how do people, I know as a mom, I personally haven't dealt with a loss, but we feel a lot of guilt when we take away time from our children, whatever reason that is. So how do we get over that? Yeah, putting ourselves first is great, but maybe could your partner kind of help push you in the direction, or are there other things that maybe would be helpful?
Yeah, absolutely. So I will say that I get a good number of referral or emails from partners actually that are reaching out on behalf of their wives or their spouses because they know that she needs help. And so that's always great. If you can enlist your partner to try and help you find a provider, that's awesome. I think the mom guilt issue is something that is just so tough. And one of the things that I always stress to my patients is that this is not actually, this feeling is something that's coming from the outside. Like this is something that our culture has put on us as women. I always like to give the example of a couple of years ago, I was leading a mom group and there was a woman in the group who had her, I think it was like at that point, probably a 2-week-old. And she was, we were in DC, she like worked at a fancy law firm, very well-educated, successful woman. And she found out that she was going to be allowed to take an extra 2 weeks of maternity leave. And she didn't know what to do. She was like, I feel really guilty because that means my team needs to take on 2 extra weeks of work. But then if I don't do it, I feel bad because I should spend this time with my daughter. And it was sort of like, would any of these choices not have you feel guilty? Like, when do you not feel guilty? And she's like, never. I always feel guilty no matter what I do. And I think that's kind of helpful example that it's like the guilt is sort of like this check engine light that's just always going, but it's not an accurate sensor,
Yeah.
as a mom. And so I actually recently started a new company. It's called Gemma Women, and it's a digital education platform specifically dedicated to women's mental health because I found out kind of being in this social media space that it's like as a mom, there's so many classes you can take, but they're all focused on the baby. They're all about, how to sleep train your kid, how to give your kid solid food, or how to have a natural delivery. But there was nothing focused on mental health. And there's also nothing focused on mom. And like your mental health as a mom is arguably the most important piece of the puzzle. But why are we spending all of our time trying to figure out what type of baby swaddle to buy as opposed to like actually dealing with our thoughts and feelings? So last week I just launched our first class, which is Unload Mom Guilt.
Oh, no.
Martyr Mode and Perfectionism. So you guys can find it on my Instagram page. It's like an online digital course that you can download. And it's all about like just working with the thoughts and feelings and trying to find some actionable strategies that you can use to fight back, because this is just everywhere. It's so insidious. I think it's baked into our culture. And I think when it comes to perinatal loss, it's just so evident. Like, here's something that 1 in 4 women are going to experience, yet we don't talk about it. We just brush it under the rug. We go back to work the next day. We act as if it's a non-event. We feel bad and feel like it's our fault. If this were something that men went through, there would be campaigns everywhere. There would be billboards.
Yeah. There would be a lot. That's for
Right.
everything in women's health, including women's sexual health,
Yes.
everything. Yes,
Yes.
absolutely.
Yes.
But that's amazing that you've done that. I think that is fantastic. And I completely agree with you that we need to focus more on the mom's health. I mean, babies have been like raised for billions of years, right? And like with minimal input from society. And now it's like, put it this way, do them this way, do that, do this, do this. You're going to ruin their life if you do. It's a
Right.
little bit overwhelming. And so I
Right.
think that obviously plays into women's mental health, but also like, it's like we deliver the baby and everyone forgets about the mom. It's like, okay, now
Yep.
it's all about the baby.
Right. Right. And I think like, just like linking it back with the loss conversation, I think it absolutely fits there too, because it's like you unfortunately you have a loss, and then it's like, but you're still there and you still need taking care of. And yes, even though your family wants you to move on, you want to start trying again, et cetera, like you really have to invest in yourself and take care of yourself during that time. Otherwise, whenever you do have your next pregnancy, you're not going to do as well emotionally unless you put in that time.
Yeah, and to be the best mom you can be, you need to be the best person you can be, and that includes your mental
Mm-hmm.
health. And I
Mm-hmm.
think just the whole process of going through emotions and allowing yourself to feel things and like ending that cycle, kind of really walking through it or leaning into it is so important. And just feel like you're not alone. I think a lot of the times we feel like we can't talk about XYZ because somebody might shame us or embarrass us or say whatever it is, but it's just so valuable to be heard and
Mm-hmm.
to have a tribe of people to help you with that.
Yeah. And I think like one of the things I see in my practice is that one reason women don't spend the time is because they are spending all their time and energy catering to their families, to their partners, to other kids in the house, to in-laws, parents. And you have to recognize that like eventually you're going to burn out. And even though you may not always recognize it, if you're running on empty, you're going to end up lashing out in different ways. You're going to be less patient with your kids. You're going to have a temper. You're going to, like all of this stuff will come out sideways unless you kind of address it more directly. So I think, one of the fears is like, well, we in our culture, we always just want to be so productive, right? We want to move forward, especially when there's been a loss. There's this sense of like, oh my gosh, I wasted all this time. Now I have to start over, right? Like we're kind of always racing. So I think trying to remind yourself that it's okay to slow down. It's okay to spend some time and energy on yourself. That's an investment, and it's only going to make things better for you in the long run, when you eventually do get pregnant again. Because I don't know, it's just so easy to think of it as like wasted time.
Oh, for sure. I mean, especially because now more and more professional women are waiting longer to have children, so they feel like they're racing against the biologic clock. They need to
Mm-hmm.
get pregnant. They need to, do XYZ by a certain period of time, and there's all this enormous pressure to get it done. So definitely a real issue.
Mm-hmm.
Shifting to the partner side of things, how can partners be like one be cognizant of these things and like look out for warning signs in their spouse and also kind of be helpful?
Yeah, well, I think it's definitely important to look out for some of these signs of like decreases in functioning, not being able to get out of bed, having to call off work, noticing that there's issues, with functioning. That's definitely the biggest piece. I think for partners, it's sort of similar to with friends, like just a capacity to be able to hold some space for the grief, not rushing your partner into getting over it, not trying to reassure them or say like, don't worry, it's going to happen next month, etc., but just like giving your spouse permission to feel that sadness, giving your spouse permission to actually talk about what was lost, use the baby's name, um, and actually kind of grieve that together, kind of talk a little bit about what you had imagined for the future. I think one of the things about pregnancy and perinatal loss that's so hard is that we're losing, you're kind of like losing this imagined future, this imagined time that you had for what your family was going to look like. So it's important not to brush that under the rug. And as a partner, really being able to um, give space to that in your family. Another thing that can be really helpful is having rituals during anniversaries, like, you know, every year during the anniversary of the miscarriage or the birthday of the child that was lost, having something special that you do as a family. I think in families where there has been loss, it can be really important to honor the child that was lost as still part of the family, and doing that in whatever way feels like it fits the culture of your family.
Yeah, that's really great. And also the spouse has to grieve too. I mean,
Mm-hmm.
they've lost, and
Mm-hmm.
I'm sure they deal with it in different ways. And is there something that women need to look out for in there? And of course, we're talking about hetero relationships here, and there are
Mm-hmm.
all sorts of relationships. So it could be a female partner or a transgender partner. But how could they? What should they be concerned about too if they're feeling okay, but they want to make sure their partner's okay?
Yeah, I think that it's just really important to have open communication, checking in with each other to see how you're doing as a couple, how each person's doing individually, asking each other questions like, what do we both need this week, right? Like, what do you need this week that's going to help you be able to move through your grief? And maybe that might be for your partner, that might be taking an evening to get together for, like, you know, a guy's night or something like that. Or maybe it means that your partner goes on a run by themselves, or, you know, I think having some of that alone time as well. Everybody grieves differently, right? So you don't want to put pressure on them to do it in a certain way. Their grief is probably going to look different than yours, but so the best way to be able to address it is to talk about it and ask them and just kind of be curious of, what can I do to help you? What do you need right now? And if you're finding that there's a block there, that the communication is breaking down, couples therapy is always a really great option as well, to help bridge some of this communication.